Good day. Welcome to Westchester Talk Radio, westchestertalkradio.com. I'm John Marino, and we are produced by Sharc Creative, made possible by Entergy, the Indian Point Energy Center, supporting our communities through April of 2021. Lipolis Electric, don't be left in the dark. Get Lipolis. Hightower Westchester, managing your wealth to a fiduciary standard, and White Plains Hospital. Special thanks to our heroes on the front lines at White Plains Hospital for all they've done throughout the COVID-19 pandemic of 2020. Joined here in our isolation therapy series by Dr. Sherlita Amler, Westchester County Commissioner of Health. Dr. Amler, good morning, and thank you for joining us here on Westchester Talk Radio. To begin with, we seem to be in a second wave of the COVID pandemic. Are we in that second wave? Is that how you would describe it now?
Earlier in the year, in March and May, things kind of calmed down a little bit, but certainly the numbers are higher than they have been since the spring of this year.
Mm-hmm. What are the hot spots in Westchester now?
Well, I mean, I don't really like to use the term hotspots because it makes people feel like there are areas in the county where they don't need to worry. And the reality is we have COVID throughout Westchester. So anywhere you are, you should be wearing a mask and doing social distancing. So there are areas where we have more cases than others, but is that because we are actually doing more testing there? There's a lot of variables. So I think the best thing I can tell people is we have COVID throughout Westchester, and wherever you are, you should be doing things to keep yourself and your family safe.
How about the latest from New York State? What are the numbers at the moment?
I haven't seen the numbers for this morning, but I can tell you that in Westchester, our case counts have been running between about 500 and 600 cases a day, new COVID cases a day in Westchester. And we don't want to see them any higher than that.
What do you attribute the rise in numbers to? We did such a great job just basically knocking the curve all the way down, and then the numbers go up again. Is it because people don't social distance, because they seem to be gathering more since Thanksgiving, since it is the holidays, or people saying to themselves, well, I'm not going to be locked down anymore. I'm going to get back to my regular, normal life? Since
literally about March of this year. And the numbers have gone up significantly. Like I said, we had a little bit of lower numbers in the summer, but people were able to social distance outside. And now, as the cold weather has returned, it's harder to do the social distancing outside with your friends and family when it's 30 degrees outside. It's also harder to eat at a restaurant out of doors. To do any kind of out-of-doors activities. So this pushes people indoors, and we know that in close proximity with individuals who are infected with COVID, indoors, especially if they aren't wearing a mask, increases your chance of getting COVID. So I think it's simply that we've all moved indoors, and people, yes, don't always wear masks, and no, they don't always social distance, and they seem to believe that they can tell who is sick and who isn't. And unfortunately, about 40 to 50% of people who have COVID have absolutely no symptoms at all. So, I mean, you and I could be in the same room and you could look fine, and yet you could have COVID and be able to spread it to others, including to me. And so that is a dangerous way to look at this. And so we have to follow the guidance no matter whether we think we're safe or not. Because I've had so many people tell me, I'm safe. Well, how do you know you're safe? There's no way to know that you're safe. And so we have to assume that every single person that we are around has the potential to give us COVID and deal with it in that manner. So that means that we wear a mask and we social distance. And that's the only way that we have to really prevent this disease from spreading further.
Mm-hmm. We've had a lot of controversy around the tri-state area about indoor dining. Does that seem to make a difference with the numbers, or not so much, from what you can tell?
I really can't put a finger on whether or not that's a problem per se, but I will say that, anytime you put large numbers of people in a small space, you run the risk for COVID spreading in that population. So it was great when we could do outdoor dining. Right now, because of the executive orders of the governors, there's limited indoor dining, and I think as long as we follow the guidance, that's relatively safe. What isn't safe is, when you have people that don't follow the guidance, and we hear about 30 people having a meeting together in a small space, and then the next thing I know, I'm getting a call that one of those people tested positive, and then we have to reach out to every single person who was in that facility, in that room, to tell them that they've potentially been exposed and that they need to get tested. I think at this point, we're all aware of the facts. We all know that it's not a good idea to be in these large social gatherings, that there's a risk with that. So it's just, do the things that you already know. But I think people are just tired. They're tired. They've got, COVID fatigue, plague fatigue, whatever you want to call it. And they're like, I just want to do what I want to do. And I think we all agree with that. But the risk is, we are so close. We have vaccines in our community. We have medical providers being vaccinated even as we speak. And you would hate to, to potentially die of COVID when the vaccine is here. So we just have to hang on a little bit longer, do the things that we're supposed to do, get our vaccines, and hopefully at some point, very soon, we'll be able to go back to life as we know it before COVID happened.
How difficult is it to contact trace once you find out someone might have been exposed? The numbers of people, the positive numbers of people every day has been a challenge, but we have hired a lot of new contact tracers. We've trained these individuals, so we have people making the phone calls. The other problem, besides having adequate staff, which I think now we have adequate staff to meet this need, is that we have to get the public to be willing to answer their phones. So a lot of people just, if it's not a number they don't recognize, they just don't answer their phone. If it's a number that is trying to reach you, please pick up the phone and answer. Well, the incubation period is about 12 to 14 days. Most people don't have any symptoms that aren't infectious within the first couple of days after they're exposed. So if I can reach you and say, you need to quarantine yourself, you need to stay in a bedroom and a bathroom and not expose others, because you could potentially have this virus and spread it to anyone that you're around. If I can do that before you're infectious, then I can prevent you to giving it to someone else. And then that person becoming infected and then giving it to someone else. And then that person becoming infected and giving it to someone else. So that's how you stop a disease that is communicable. You get to people before they're infectious to others or shortly thereafter, and you prevent them from exposing other people. How often do we need to be tested? How often should we be tested?
Well, anyone who has been exposed to a case and symptomatic should definitely be tested. People who have symptoms of COVID, whether they know if they've had an exposure or not, should be tested. Who shouldn't be tested are individuals who've had a test and that test has been positive. There is no need to get another test, because once you've had a positive test, you're in isolation for 10 days from the date of that test or the onset of your symptoms. And getting further tests is not going to change that fact. You're still going to be in isolation. The other people that should not get tested are people who've been named as, a contact. So you've had an exposure and you're in quarantine. And we have people who want to go in and get tested to say, hey, I'm negative. I don't need to be in quarantine. No amount of testing will get you out of quarantine because, as I said earlier, it's an incubation period that can last up to 14 days. So I don't know when in that 14 days you may potentially become positive and be infectious to others. You could be tested today and be negative. You could be tested tomorrow and be positive. Anytime up to that 14 days is over. So simply getting a negative test at any point in your quarantine period doesn't take you out of quarantine and doesn't mean you couldn't go on to give it to somebody else in the next day or the day after that or the day after that.
Dr. Sherlita Amler, Westchester County Commissioner of Health. Now we have a couple of vaccines approved by the federal government. How effective, from what you've seen, are these vaccines from the studies that have been done?
As vaccines go, the two new COVID vaccines have a very high effective rate, meaning they do a great job of protecting people against getting COVID.
Now, if you had a flu shot, is it okay to get a COVID shot?
Absolutely. We want people to get both their influenza vaccine and the COVID vaccine when it is available to them. Right now, the COVID vaccine is being rolled out, and so they're starting with healthcare providers, and they will also be vaccinating very shortly residents of nursing homes and their staff, and then it will eventually be rolled out through the rest of the population. So we just have to be patient. Vaccine is coming every day, so we'll get to all these groups shortly, and everyone just needs to be patient. But when you have the ability to get the vaccine, I would strongly encourage you to do so.
Pfizer, you have to get 2 shots. Moderna's version, 1 shot, supposedly.
No, Moderna's 2 shots too.
Will be 2 shots too?
Both of these, yes, both of these are 2 shots. The amount of days between them is slightly different. Pfizer is 21. I think Moderna is 28 days between. You should get, if you get a Pfizer, the second shot has to be Pfizer. So it's important that you know what vaccine you received, and people are being advised to go back to wherever they got the first shot. That's where they'll be asked to return for their second. But you do need to stay with the same particular company that you received the first vaccine for.
So you get 1 shot and you have to go back in 3 to 4 weeks for a second one. What happens in between? How protected are you at that point? Are you not really protected yet? Where do we stand with that?
So unfortunately, most people think that they can get a vaccine and that immediately after the shot that they're totally safe and they can do whatever they want. And vaccines don't work that way. It takes your body time to start making antibodies to protect you against whatever you have been, immunized against. So it will take a couple weeks before your body starts to produce antibodies. So what that means is after someone gets vaccinated, they still need to wear a mask. They still need to social distance until they've received both doses. And even after that, we'll probably continue to do masking and social distancing for a little while till we get the entire herd immunity established. So to get herd immunity, we need to literally vaccinate between 70 and 80% of the population. And once we reach those kind of numbers, then there's less of a chance of people who are unable to get the vaccine for some reason, being exposed in public. So like with, let's just take influenza vaccine, for example. There are people for medical reasons that may not be able to get an influenza shot. And so in order for them to be protected, we would have to have about 80% of our population getting an influenza shot so that they would not have to worry that they could get influenza by just being out in the public. And the same thing is going to be true of COVID. We will need to vaccinate between 70 and 80% of our population before we have enough people vaccinated that it's not going to just be a problem for those people who, for whatever reason, medically, cannot receive the vaccine.
How do we know if the vaccine is working within someone? If you or I got the vaccine today and we'd have to go back in 3 to 4 weeks for the second shot, how much time should we give it to know for sure that we are protected? Maybe 3 months down the road, we get COVID anyway.
Well, I think we're going to have to see what happens. I mean, this is a new vaccine. It's a novel vaccine. We haven't, there have been studies done, phase 3 studies. They've certainly studied tens of thousands of people, but that's not the entire population. So we will be watching as this rolls out. Everyone who's vaccinated will be watching to see what happens with these individuals, and there will be, numbers for people to call if they, if they have reactions to the medication, or if they go on to develop COVID. Certainly, the medical community is going to want to know these things so that we can monitor the course of this and see how it does.
How do we find out when it's our turn to get vaccinated? What's the process, the procedure?
Well, we're still trying to figure all that out right now. So every area in the state of New York has been assigned to a hub in Westchester. Our hub is the Westchester Medical Center and Vassar Brothers. And so they will be outreaching through, I'm sure, medical practices and hospitals as they have sufficient vaccines. So we'll just have to stay tuned, pay attention to the information that they're giving us so that we know when we'll be able to receive vaccine and where.
Mm-hmm. Do we each get notified individually that it's our turn?
I don't think that's how it'll roll out. I think it'll be more general public announcements, public awareness announcements. But, like I said, the hub is handling this. I'm not handling this part of it. So we'll have to wait and see how they do end up rolling it out.
Do we need to have a mandate saying everyone needs to be vaccinated to make sure we get this done and get our lives back to what it normally was?
It takes time to vaccinate people. So 2 weeks, a month. I mean, this is going to be a process that's going to roll out probably over the next 6 months. And so we'll just, it's one day at a time. We'll get through this just like we've got through the last year. We just all need to be patient, continue to keep doing the things that we've all talked about. The masking, we have the availability to get vaccinated. We need to roll up our sleeves and do it. And I know that there's going to be a lot of people that are going to have a lot of questions, and I would really recommend that they reach out to their healthcare provider, whoever that is, start having those conversations, any questions that they have. And I'm sure there's a lot of information that's going to be rolling out from the CDC, State Health Department, and hopefully all this together will go a long way to making people feel very certain that this is the right thing for us to all do.
Our thanks to you, Dr. Sherlita Amler, Westchester County Commissioner of Health, here today on Westchester Talk Radio. Doctor, we thank you very much. Much appreciated. And we know you got a tough job ahead of you there trying to get all of us vaccinated. And thank you for all you've done throughout this pandemic.
You're welcome.
Thank you.
Happy holidays.
Happy holidays to you, too. Nice to have you here in Westchester Talk Radio. I'm John Marino, our Isolation Therapy series, and we are made possible by, produced by Sharc Creative, made possible by Entergy, the Indian Point Energy Center, supporting our communities through April of 2021. Also, Wartburg Healthcare and Rehabilitation in Mount Vernon, Park Sterling, Realty in Bronxville, and Michael Labriola Landscape Design and Construction of Armonk, and catch all of our Westchester, Fairfield County, Putnam, and Dutchess Talk Radio programming on our YouTube channel, Sharc Creative YouTube.